Hello everybody, my name is Dr. Kajohnsak Wongwirach. I'm Assistant Professor, Faculty of Management Science, Lampang Rajabhat University, Thailand. Now I want to present research article, the title, Community-Based Adaptation Affecting Quality of Life in the COVID-19 Situation. Case study of Upper North Region, Thailand. Scope of presents: first, introduction; second, objective; third, research methodology and result; conclusion and discussion; and the final, suggestion and limitation. The first, introduction. Due to the pandemic of the coronavirus COVID-19 spreads the infection from humans widely and to countries globally. This pandemic affects the political, economic, social, and cultural dimension greatly to any country and Thailand. Preventing the outbreak of the COVID-19 is a direct role for public health agency to issue policy, guidelines, and regulations to enforce within the country. They can reduce the dangerous the COVID-19 outbreak, which leads to a new way of life. The example measures are the requirement of the people to wear masks whenever leaving their home, regular hand washing with alcohol gel, social distance, reducing the crowded community in a limited area, or even providing online instruction at educational institutions for all levels. The people usually act until it becomes new typical behavior. In addition, the COVID-19 outbreak doesn't primarily affect only the people health form, but it also affects many areas, such as the micro and macro tourism economy. Because the people reduce the risk of traveling to risky or congested places, causing some stores to announce the closure or temporarily stop their service according to government announcement. According to the issue of the COVID-19 outbreak affecting the global people include in Thailand various dimensions, both economically and socially, and the way of life. As a result, it is an issue that leads to research in exploring the adaptation of the people in the situation of the COVID-19 pandemic. Second, the objective research to propose guidelines for community-based adaptation in the COVID-19 pandemic in Lampang and Lamphun province, Upper Northern region in Thailand. Next, research methodology. We use research apply the survey research and qualitative research, studying with target group or informant, community leader consisting of the village headman, village health assistant, and those who play a role in conducting health activity in the community in Lampang and Lamphun province. With the total number of samples is 108 samples. The research tool use the semi-structured interview and questionnaire, which the issue include the topic, First, the impact of the COVID-19 pandemic situation on the community. The second, the community-based adaptation to the COVID-19 pandemic situation. Third, the good practice or innovation, effective communication, and approach to prevent and mitigate the COVID-19 problem. The final topic, the new normal community and action to strengthen family and community with adaptability. Research to development and quality testing of the tool was carried out by the nationwide Rajabhat University Network. 38 Rajabhat University in Thailand and was accredited by the Human Research Ethics Committee of Nakhon Ratchasima Rajabhat University with the certificate number HE13X 2020. For the data analysis, we use content analysis to present the research result collected by interviewing. The research results, the first, to present the impact of the COVID-19 pandemic situation on community, where community leaders have present information on their impact on the community in various dimensions, particularly the economic dimension, especially from community which are based for the occupation of agriculture. Moreover, referring to the pandemic of COVID-19 in the first round, it resulted in industrial workers. Some companies were affected to stop working, laid off in company. Then, an increasing number of people in the community moved from other provinces to live in the community. The community needed to find measures to support both the prevention of the virus outbreak and various social problems within the community. Besides, the people in the community had the effect on the dimension of tradition of the community, typically multiple proofs, traditional and custom that people in the community practice and often inherit as rituals and step-by-step activity. Consequently, the impact on the community leads to the problem in three dimensions. The first dimension, the impact on the household economy of the people in the community. The second dimension, the impact of social issues in the community. And the final dimension, the impact on the tradition of the community. Next, the community-based adaptation to the COVID-19 pandemic situation. As a result of the first wave of the pandemic situation of COVID-19 in early 2020, as well as the second wave of outbreak in early 2021. Both waves set the community to adapt to the COVID-19 pandemic by raising perception within the community, focusing on resource management within community to promote food security. Next, the good practice are effective communicative innovation and guidelines for the prevention and mitigation of COVID-19. Information management innovation have been created, especially information about the COVID-19 outbreak for community use. Some communities have established a communication management model within the community by connecting the community leader and government agency to create awareness and good understanding of the people. So, I want to present the model of the community management mechanism under the COVID-19 outbreak or emerging disease. Follow the picture, you can see the two factors. The first factor is external motivation of the community. Government support, enforcement measure, practical guidelines at provincial level, local monitoring. And the next factor is internal motivation of community. Community cooperation, way of life of the people in the community, community relation and network in the community. The two factors for two mechanism for community management mechanism. The first mechanism for building community health network cooperation and community communication management mechanism and community-based economic management mechanism. From the picture, the community management mechanism under the outbreak of COVID-19 or the emerging disease consists of a mechanism for building community health network cooperation, because a mechanism the community can create by establishing an agency within the community or a network being as a tool to support and supervise about health includes various surveillance relates to the health and quality of life among the people in the community. The second, the community communication management mechanism is a mechanism of managing communication channel to generate awareness, create understanding, building awareness, and prevent public awareness of news that may not be screened. The last mechanism is the community-based economic management mechanism that promotes and supports the community's people to build economic immunity in the household, both in terms of reducing expense and generating additional income under resource capital. It is an essential mechanism in community management that leads to a better quality of life for the people under the pandemic situation of the COVID-19 or the emerging disease. Next, conclusion and discussion. According to determining objective to present guidelines for the community adaptation to the situation of the COVID-19 pandemic in the area of Lampang and Lamphun province, Thailand, can be seen that the impact on people and community consists of the economic dimension within the community, the tradition of the community dimension, and social problem dimension in the community. The communities with large number of elderly may also impact their mental health risk. Well, various government agencies relate to restaurant establishment for event public concerns about the situation of the COVID-19 pandemic. Well, presents their resource in the supply chains in the food industry, causing the demand for certain food to decrease. Besides, the loss for a raw material could not be export and import due to the city lockdown. Finally, there was a systematic effect on the food industry and the economy. Nevertheless, the presentation of community management mechanism under the outbreak of COVID-19 or emerging disasters to contribute to building capacity and communication capacity and suitability in solving community problem and situation caused by the COVID-19 consists of 3 mechanisms and 2 drives. Suggestion and limitation. To conduce this research, there are limitations in this research area in only 2 provinces, Lampang and Lampung province. It's in northern Thailand. Therefore, the finding may be limited to that particular area. Based on the research result, present impact, adaptation, and community management mechanism are presented. The government agencies that play a role in public health or community leaders at different levels can apply the research finding to the context and appropriate needs. Thank you.